Hello and a very good morning to each and every one of you. This is our second video under the series of getting to know your hearing loss or understanding your hearing loss. Today we are going to speak about conductive hearing loss. Conductive hearing loss is when there is a problem in the sound transferring from your outer ear to your inner ear. I'll explain it to you in a bit more detail in the following slides. So let's jump in. Before I move on to the description of conductive hearing loss, I thought what would be best is to have an overview of how our hearing apparatus is and how we hear. So in this diagram here, if you follow my pointer, you can see that this is the outer ear, that's your pinna. And whenever somebody speaks, the sound wave, it travels through the outer ear, through the ear canal and reaches the eardrum. This is like a small membrane. It's like the drum, like the diaphragm of a drum, okay? And the speech sounds, the vibrations reach the eardrum and impinge on it. And the eardrum then starts to move. The vibrations travel through the small chain of bones, which is hoisted in the middle ear, which is housed in the middle ear, and reaches this purple snail-like structure. This snail-like structure is called the cochlea. That is the main sensory organ of our hearing. And when the vibrations travel through the middle ear, they are amplified a little bit. But when they reach the inner ear, these vibrations, they are further amplified by tiny hair-like structures called the outer hair cells. And then these amplified vibrations reach another form of cells known as the inner hair cells, which convert them, they transduce them into electrical impulses. And the electrical impulses are then captured by the auditory nerve and taken to the brain where the speech signal gets processed, and that's where auditory processing takes place and we make sense of what is being heard. Whenever there is a problem in the sound, the natural movement of the sound from the outer ear to the inner ear, that is either the outer ear or the middle ear, when the problem lies in either of these two areas, it results in a type of loss known as a conductive hearing loss, because it is a failure of the natural movement of conduction or sound from the outer to the inner ear. In the next slide, we'll have a look and understand about, have an understanding of what is it that's actually causing this hearing loss, okay? What is it that breaks this natural movement of sound from the outer ear to the inner ear? We can see that the causes have been divided into two sections: causes due to damage to the external ear and causes due to middle ear conditions. Let's have a look and see each of these in a bit more detail. First, I'd like to talk us through the external ear conditions. The external ear comprises of the pinna that we saw and the ear canal, okay? So the most frequently seen and most common condition that makes you feel like your hearing is muffled is the presence of earwax. Now, earwax in itself is not a pathological condition. Everybody produces earwax, and small quantities of wax is actually quite beneficial to the ear. It protects your ear from different organisms. It prevents from dust and dirt from getting inside your ear. It also is self-clearing in itself. But sometimes earwax can get collected and it can then clog the ear. It's only when earwax completely blocks your ear is when it can result in a hearing loss or making your hearing feel like everything's a bit muffled. Earwax can be treated quite easily by ourselves at home by using either olive oil drops or then getting it suctioned privately or getting it removed by your doctor. Other conditions such as having foreign bodies in the ear can also impede your hearing. We have seen cases where there have been small insects or either small bits of toys like Lego or even things like an eraser getting stuck in the ear. So if you feel like there's been a foreign body or something that may be stuck in your ear, it's best getting it looked at so that we can safely extract it. Fungal infections, exostosis or otitis externa, that is swimmer's ear, is quite common in individuals who swim or surf, what happens is whenever there's any residual water that's stuck in our ear, that can then create a very conducive environment for fungi, or some people call it fungi, to grow. So they like that sort of warm, moist sort of an environment, and that can lead to a fungal infection. These are usually treated with maybe microbial drops or antifungal drops that you can put in the ear, and very rarely need any oral medication. Certain conditions can, anatomically change your ear, and this can be from birth. So certain conditions where there's abnormal formation of the outer ears, like a microtia or an anotia, where there's no opening of the ear, or no pinna, or an atrasia is a narrowing of the ear canal. Now, this can happen in various degrees. So generally, if it's a mild form of an atrasia or a microtia, that generally doesn't cause a hearing loss. But more severe forms, where there's complete closure of your ear canal, that can result in a hearing loss. Moving on to conditions of the middle ear that can cause a temporary drop in your hearing. One of the most commonly seen conditions is called otitis media. Otitis media is a type of ear infection where there is fluid accumulation behind the eardrum. This is more often seen in children, but it can also happen in adults. And it usually presents with symptoms like ear pain, a sense of fullness or pressure behind the eardrum. It can sometimes also be accompanied by a slight fever or a temperature in children. So if you have any of these symptoms where you get like a dull ache in the ear, which is progressively getting worse, being unable to clear your ear, and a sense of fullness or pressure, that can indicate an ear infection, especially if you've had a cold before the onset of these symptoms. If it is so, it is a very good idea to seek a consultation with either the GP or the pharmacist, and if they think that this is something that needs further intervention, they will then refer you to the ear, nose and throat consultant. Another form of an infection that can cause a drop in our hearing is called a cholesteatoma. Now, a cholesteatoma is something that if left untreated can actually become quite dangerous. It is like a small collection of a debris and dead skin cells that accumulate into a small lump, if you can say. It's not actually a lump, but it is like a growth that it's because of the collection of all the debris, and sometimes that can corrode the bone of the middle ear, and it is best to it is sometimes it can be quite asymptomatic, but if you feel like your hearing is reducing and you feel some discomfort in your ear, it's best to have it looked at by the ear, nose and throat consultant. Sometimes nasal growths and tumors can also temporarily cause a drop in your hearing, or certain growths in our ear canal is called exostosis. If they're quite severe, they can impede your hearing by narrowing down the ear canal. Eustachian tube dysfunction is yet another condition where there's a small tube that runs from the very back of our nose into the middle part of the ear, and the main function of it is to actually ventilate the middle ear. So whenever there's a drop in pressure, the eustachian tube opens and closes to let air in or out. And if that gets congested, it can sometimes cause a vacuum behind your eardrum, or can result in fluid accumulating in your middle ear, which then consequently leads to a drop in your hearing. So all of these middle ear conditions can leave you with a conductive hearing loss. Now that we've understood the sort of conditions that in the external ear and the middle ear that lead to a conductive hearing loss, let's briefly look at what are the symptoms or the red flags that might indicate that you are suffering from one. So basically, as with any hearing loss, the first thing that you would notice is that you're struggling to hear. You may feel like people are mumbling, you may feel like your hearing's a bit more muffled, or you're mishearing certain words. But along with this, there are certain things that that directly point us towards the chance of having an ear infection, or a conductive loss, and that is either fluid coming out of your ear or some form of discharge. It may be a clear discharge, it may be purulent, it may sometimes have an odor as well. If you have any ear pain or any tenderness exactly in front or behind your ear, there can be a fluctuating hearing loss. So you may feel like you're hearing better sometimes, and you may feel like your hearing's a lot worse in the others. This sort of fluctuation is quite common in conductive hearing losses, because the problem is not with the organ itself, it is in the path of the sound traveling from your outer to the middle ear. So maybe if it is like a congestion in the eustachian tube, if you pop your ears, you may feel like you're hearing better, and then the eustachian tube might close up again, and then your hearing may go down again. So there's this transient type of a loss that can happen. There can also be a constant sense of pressure behind your eardrum, the need to feel like the urge to make them clear or pop can be one of the symptoms. A feeling of being underwater, or clicking and popping noises in your ear. This can either be spontaneous, or it can be like when you're chewing or swallowing or yawning, you can hear slight crackling noises or popping noises. This is a very strong indicator of a eustachian tube dysfunction. So you can either have any of these symptoms in combination or isolation. Very rarely a person would have all of them together. But generally, if there is any discomfort in your ear and you feel like you're struggling to hear, it is really a good option to contact your GP. He'll be your first point of contact. So say if you had any of these symptoms and you've met your GP, you've had your treatment where you've had either antibiotics orally, or if it's a middle ear infection, it's generally an oral sort of a medication, antibiotics that they give you. But if it's more of an external ear condition, they generally treat it with antibiotic drops or sprays that you can have in the ear. If it's quite a mild infection, it should get resolved when you do any or all of these treatments. But sometimes if it's a bit more severe, then you may need to see the ear, nose and throat consultants. So they generally take a swab of your ear, they look at your ears under a microscope, they may use a microsuction to clear out your ear if there's any debris or fluid. In many young children, if it's a repeated ear infection, then they may consider options like having grommets put in, or sometimes if necessary, they may do surgical management options, especially if it's an eardrum that's perforated and it's not healing, or whether it's a repeated infection that has caused any changes in the middle ear. Then they may discuss surgical options as well if deemed appropriate. Very rarely, hearing loss can be chronic, which means that you may get infections one after the other, maybe every 3 months, maybe if it's something that has been treated before, but it's not healed up and it's constantly happening again and again. Such type of losses are called chronic conductive losses, and frequently there may be chances, not very frequently, but sometimes there may be chances that we need to go for other forms of management apart from antibiotics, apart from medication, apart from surgery. And that can be either the option of having hearing aids, special types of implantable devices known as bone-anchored hearing aids, which is the BAHA, or middle ear implants, that is the MIEs. I will talk about all of these different management options in detail. We'll go through the different types of hearing aids that we have, what a BAHA is, how it works, what are middle ear implants, in the following series that is going to come up regarding management of hearing loss. But in the meantime, if you like this video, please give it a thumbs up. If you have any doubts or questions about conductive hearing loss, or you would like any more specific information, or you have any questions, please get in touch with me. I would be more than happy to help you out with the information that I have. And that's about it for today's video. So Thank you so much for watching it, and do drop down your comments, and I'll see you very soon. Bye bye.